Hi, I'm Cecily. I'm a PA here at Posmic. I work for Dr. Lund. I've actually been working for him for almost 2 years now. But a lot of people don't know what a PA actually is. So we recently had a name change a few months ago, and we now are called physician associates instead of physician assistants. And I think that really speaks to what it is. Our schooling is, you go to an undergrad, you have a bachelor's degree and kind of actually whatever you want. You just have to have specific prerequisites for PA school. So you have to have a science background, you have to have taken anatomy and biology, chemistry classes, physics classes, and then you have to get a bunch of healthcare hours. So I did my healthcare hours as a scribe, and I worked as an EMT for a little bit, and then I worked with hospice. With that, most PA schools require about 500 clinical hours before you go into school. And to get into PA school is actually really hard. Sometimes people say it's much harder than medical school just because of the sheer amount of people that are applying and getting in. So I went to Hendrix College in Arkansas for my bachelor's degree. I went to LSU for my master's degree. The PA school is 2 to 2.5 years. Mine was 27 months, and it's actually in a medical model type of learning. So what that means is they basically take pieces and parts of medical school and condense them down into about a 2-year process. So the first year to 15 months is all classes, and you learn about diagnosis and how to treat them and different disease processes. And after that first year, you have so many tests. I think we took a test per week, and it was a lot of information all at once. But when you take a medical school type of program and you condense it down, you kind of have to get the real basics of everything. And then you go into your clinical rotations, and that is minimum of 12 months of rotations. I actually did 15 months of rotations. So we had family medicine, we had orthopedics, we had ear, nose, and throat. We did hospital medicine and the ER and a whole bunch of other different things. And I actually really like orthopedics, and so that's why I came here. After school, you do take a boards exam as a PA, and you can't take it until after you graduate. So a lot of other different medical professions, you can take it before you graduate, but we actually have to graduate school, pass our test, and then we can work as a PA. Again, I said I've been here for 2 years, so this is actually my first job out of school, and I really enjoy it. Like it's kind of complicated. So Dr. Lund works in hands and elbows and shoulders, and the hands are really complicated things, and so I had to learn a lot here, and Dr. Lund was a really great teacher about all the different bones and all the different ligaments and things like that when it comes to this. So that's kind of what a PA is. We can also work in so many different fields. Orthopedics specifically, we see patients, I can send medications, I do pre-op exams, I actually go to surgery with him, and I am extra hand in there for whatever he needs, whether it's suturing or holding instruments or things like that. And then, you see us in the clinic, and that's what a PA is.